Hey everyone, welcome back. It's Mishta with a lot of madness. Whew, and today's madness is pain madness and discomfort. Um, I think it's the 23rd, and so that's 3 days after my surgery. I was in a lot of pain the last couple days, but I was trying not to take the pain medication, the uh, the tramadol. Yeah, the tramadol. Um, I really don't like opiates, so I've been trying to just tough it out without them and use my cannabis gummies and my CBD oil that I make and Tylenols because I really don't like taking them either. But I was kind of in this situation, they want you to take something so you're not just being in agony. so, for any of you that don't know, I had my second surgery of the reconstruction part. It was on Wednesday, on the 20th, and I had the spacers taken out and the silicone put back in. Um, they had to go a little bit bigger. She said she had to go a little bigger because of I have no idea why. Because it would be easier, I guess, to make them look better and look more natural. So she went a little bit bigger than I already was. But I said, just do what you got to do to work your magic. Please don't go bigger than you have to, but just do what you do. Do what you have to make it, work good and to make it able for you to do your job and do it good. I go, just work your magic. And she was super cool about it. And she's like, I won't try to go big too big. I know you don't want to go big. And I'm like, no, I just, natural is good, or like a uh, uh, proportionate. And she said she would do it the best she could as far as that goes. And she probably did. I haven't got to see them yet. I have bandages from here to here. The bandages are from here to here, and they go all the way around under my arms on both sides. I am pretty swollen up here, as far as you can tell. I can tell that I'm a lot swollen up here. I think that's part of what she was doing the liposuction for. The liposuction area, you can see I have the Spanx on. I have to say, these are the most uncomfortable things, except a corset that I've ever tried on. Whew. And I used to have to, when I was younger, I used to have to wear like spandex shorts because when I had my period, I'd have really bad cramps. And so I would wear spandex shorts to help that out. And it did, it helped. But so I was used to those. That's fine. But all the way up to here, I can hardly breathe. It hurts when I eat sometimes because I have to like hold them out and like, hold them out like this so I could feel like I can digest the food tone. Um, and no, I went up a size than what the measurements said to go. I was on the bigger side of the small scale, and I tried a size small, and it was not going to even deal. So I ordered a size medium, and that's what I have on, and so that works. Um, I can understand. It wouldn't be so painful if I didn't have the liposuction. Then it would just be like, okay, put on this, uh, girdle kind of thing, and just squeezing in and roll it up, and it's all good. But because I had the liposuction, there's two spots where they went in on each side, but they went in a few different places from those two spots of where they where the first cuts were, the initial cuts were. They went in across my belly because I have spider web bruises. They went on the sides. I have bruises on my sides and on the back of my, like back here by my kidneys. And so they had to take a bunch from around there, or it affected there. And then I have bruises all the way down the middle, down to right on the top of my pelvis bone. And so it looks worse than it probably is. I guess it's pretty sore, pretty painful. I guess they had to go in numerous places from those two incisions, and they could go into numerous places and suck the fat out. But because they did that, I'm sore everywhere. Um, it hurts so bad to take these Spanx on and off to go to the bathroom. I'm just saying. I was like, holy cow. Um, because in order to try to roll them down, you have to stop and take breaks of like where it's rolled to roll another roll, and it's on a bruise no matter what I do, or the incisions. So I'm like, oh my gosh, it's pretty painful. But I've not been wanting to take the opiates. Um, I had a slight little scare at the end of my surgery. I should have been just waking up in the after, the aftercare, the post op, and just getting up and being awake and being able to put my clothes on and leave and just have my prescriptions for my meds and all that. But while I was out, they gave me a 5 milligram dose of oxycodone. I don't like opiates because they affect me probably like 2 to 3 times more than they would affect a regular person. I don't know why that is. Maybe it's because I have a fast metabolism, but they really hit me all at once, and it's overwhelming. And I get so confused and so stressed out and freaked out, and it was horrible. I couldn't wake up after the surgery. I kept trying to wake up, and then it kept sucking me back in, and I was freaking out on that. I was like, why can't I wake up? Why can't I wake up? And I was freaking out, and I kept asking the nurses, and they're like, you're awake. Just put your clothes on. And I'm like, I can't put my clothes on. I don't even know how to put my clothes on. And I was freaking out, and I remember more now than I did at the time. But I remember freaking out because I couldn't put my clothes on. They had to help me put my clothes on. And then while I was laying down, because there was no way I could stand up, I thought I was going to just fall on the ground. And it was super scary. Um, I personally don't think that they should be allowed to give a person that's unconscious opiates unless they already agreed upon that ahead of time. But that's my opinion, and I'm against opiates as much as possible. But I also know they do help people in pain, and I do figure that they should be asking people ahead of time, though. And for me, I'm super sensitive, so I would have said, if you had to give me anything, please do the lowest, but like half of the lowest dose. I go, give me what you would give a child, and they're like, they wouldn't give that to a child. Okay, then don't give it to me. That kind of thing. So for me, it was super scary. I kept telling myself it was okay, though, because I was supposed to be here. And I don't know how I kept being able to tell myself that, but I think that was the only way I didn't end up being like violent or freaked out more, because I was focusing on the fact that I just couldn't wake up, and I needed to wake up to get back to my babies. And it was super scary because I kept passing back out, and I kept trying to wake up and put my pants on and put my clothes on, and I was just laying there, and I just like was like, and I couldn't do it, and it was just like, it was crazy. I kept saying, why did you do this to me? Why did you guys give me this drug? Why did you guys put me on? I was like, I'd be waking up right now, and I'm like, I can't wake up. And they just got mad at me. They said, you can have 15 more minutes in this bed. And I was like telling myself, I got to sober up in 10 minutes. I got to get out of here in 10 minutes. I got to be out of here in 10 minutes because they gave me this much time. And I was just freaking out. And I was so lucky that I didn't get so scared and violent and just like thinking the worst thing ever. And it was really weird because I remember trying to get into the wheelchair and almost falling onto the ground. The one nurse stood across the room, and the other nurse was just holding the chair. And I'm like, shouldn't there have been a nurse trying to help me into the chair, because I was delirious at this point, and maybe apologizing for, we didn't know that this lowest dose was going to get you like this. It's okay. You're safe. You're fine. We're taking you to your son. Anything reassuring? No. The chick was not being reassuring at all. I was really freaked out over the fact that she was standing over across the room just being mad, like with her arms folded, and being angry at the fact that I could not get into the chair. And it was freaking me out. I was so scared and so freaked out that when I got into the wheelchair, the lady pretty much ran with me out of the area and just tried to get me down to my son. And I was so freaked out because I was like, oh my God, slow down, slow down, slow down. I'm going to puke, I'm going to puke. And luckily I had already said I felt like I was going to get sick, which last time I didn't feel nauseous at all. I felt hungry. I was awake. I felt good. I didn't care that I had a little bit of pain because I knew I was alive and I was able to like get up and go home as soon as possible. If you can't wake up after surgery, you're not going home. And I'm like, I was freaking out wondering why they would give someone narcotics and make them not be able to wake up. I was freaking out. If they had given me 10 milligrams, I might not have woke up. I might have literally not been able to wake up. And I would have, oh my God, I don't even know what would happen to my kids if that had happened. And so it it freaks me out that I've heard from other people that the actual norm is for them to give a patient opiates while they're out without asking them ahead of time if that's okay, and without doing anything else. Their doctor or the nurses can decide that they can have opiates before they even wake up. I do not approve of that. Especially for myself. I can only speak for myself, but I definitely don't approve of that. And I thought for sure it was in my chart because last time I said no opiates, no opiates, no opiates. They gave me, what was it? Ativan, which was a muscle spasm relaxer. It just calms you down a little bit. It was for anxiety. I've had it before. I knew what it would do to me. I knew it wasn't going to make me dependent on it. I knew it wasn't going to be like an opiate. It just chilled me out, relaxed my muscles, and just did that. But I guess maybe they usually think that that's not going to be enough for this surgery, especially if I have a lot of the liposuction, which I actually ended up having to have more, I think, than what I was hoping. um, I'm really swollen everywhere, and you can just see the spider webs go across. So I really, they did more than what I thought they were going to do. But it's fine. They got it done, and it should be all good. But at the same time, the opiate scared me, and that's why I don't want to take the tramadol. The 5 milligram dose is the equivalent of what they have me on right here as far as the tramadol, which is a 50 milligram dose. I looked it up. And so it really, really freaked me out that that did that to me. And my son was like, well, if you want to try it, because you're in a lot of pain, then cut it in half and I'll stay with you out here and make sure that you're all good. And if you can tolerate a half of one, don't go up. Just take a half of one when you need it, and that's it. And not take it 6 hours every 6 hours. Just take it when you need it at the most. And it's like, okay. But so far, I've held out. I did a bunch more of my CBD instead. I did a few more of indica gummies so it would balance it out and I would just be relaxed and I wouldn't want to get up and do stuff. And so far, so good. Yeah, the opiate thing really scared me. And I personally, with the opiate crisis that's going on in our country, think it's a little bit crazy for them to just give you opiates before you're even awake. That doesn't seem good. I mean, if someone's in a little bit of pain, it should be better to be in a little bit of pain and then get the pain reliever and then go, okay, there it is, okay. But the littlest dose, and have them know about it, because what if they can't handle it? What if I was allergic to it and I didn't know? You know? I'm like, oh my God, I would have been really losing it. So, yeah, and that would have been another medical thing on top of that. What if I was a recovering addict over opiates? You know, I mean, I've never been addicted to opiates because I don't like how they make you feel. And for me, they tried to sedate me for so many years when I was a teenager and a young adult because I had so much anxiety and depression and everything else. I was on so many different pills that I know what a lot of those things do to you, and I don't like it. And that's why I don't like opiates, because they make you lethargic and confused and not know what's going on. You don't make a judgment. You don't do things right. Things don't make sense right, even if you think they are. And to me, that's just not acceptable. I don't like that. I don't like being out of control. That's why I don't drink anymore, because I would, when I was younger, I would, of course, party and drink and, not remember things. And I didn't like that. So I automatically didn't like that kind of high. And so that was easy for me to not drink. I mean, having a drink with a friend or something is one thing, but getting drunk to where you don't remember things, that's like doing an opiate to me. As soon as I do an opiate, I don't remember things. I black out. I am confused. In fact, it's funny now because we laugh about it now, but when I got into the car, because of the whole experience of I didn't know where I was at first, and I didn't know why I couldn't wake up, and I didn't know what was going on. I didn't know why nobody was helping me. I didn't know why I felt the way I felt. I didn't know why I couldn't remember things. I didn't know why I couldn't stay awake. I was so confused. And all of those are signs of like overdose. But the nurses were just like, get the freak out and we want the bed. And so it kind of scared me and freaked me out that I really don't ever want to go to the hospital again during a pandemic, unless it's for the actual, if I was sick for the pandemic or from it. Yeah, because they just want you out and not in the bed. And so it freaked me out. And when I got into the car, I was okay for a minute. But then as we were driving, I realized I didn't know where I was, like on the road. Like I didn't recognize some of the things around me. And I was just like, wait, where am I? What's going on? And I was like, okay, what's going on? Are you trying to kidnap me? And I actually thought my son was trying to kidnap me. I called my daughter thinking that she was my mom. And I said, Mom, I think I'm being kidnapped. I don't know where I am. I know I'm in a car and I don't know what's going on. And I go, I don't know I'm so confused right now. I think somebody drugged me and I don't know what's going on. And yes, somebody drugged me. The freaking nurses in the outpatient area of the surgery, the outpatient surgery, they drugged me basically. And I had no idea what was going on. They never reassured me. They never were like, it's okay. We gave you some of this. It's all right. Nothing bad is happening to you. Nothing like that. Nothing. They just were like, nope, you need to sober up and get the heck out. You got 15 minutes before we make you leave. And I was so freaked out. I was losing it. I was freaking out. And so I had called my daughter. Luckily, I didn't call my real mom because if I had, she would have been freaked out because she wouldn't have put two and two together that I was leaving the hospital on drugs that the nurses gave me. She would have maybe thought I was really getting kidnapped and called the police. And so it was really freaky to me. It was scary. And I definitely don't want to take any of the opiates unless I have to. So far, right now, I've been managing the pain though with all the cannabis stuff that I have and the Tylenol and taking as little of that as I possibly can because that makes my stomach bleed and I end up pooping blood. And so, yeah, it really sucks when you end up having a life where you're in pain, chronic pain all the time, and you've had years where you were trying to take Tylenol to mask that pain and deal. It finally gets to your liver and your kidneys, and you can't take it all the time, or you end up pooping blood. And the doctors keep telling me that that's not how that works, but so far, every time that I've taken Tylenol for 3 days in a row, and for any reason at all, I poop blood. No matter what I've eaten, no matter what I've done, I can eat this best diet ever, and still it will happen. And they're like, "Oh no, you just are stressed out because that's your hernias or whatever, or your um, hemorrhoids or whatever." And I'm like, I don't think so. I can tell my body, and I know that's not a hemorrhoid. It's coming from. It feels like it's coming from in here and in my kidneys. I can just feel it. I go, so no, it's all good. I just will try to take them as little as possible. Just like the opiates, I'll try to not take it all. And yeah. So this is going to be a little bit of a recovery. I'm trying not to do a really long video, but there was a lot going on from the surgery. They wouldn't let me do any videos there. They were like, nope, we got to have a non-infringement on privacy, which I totally had to respect. And because they're in little cubicles with curtains. It's not, you don't even have walls, you have curtains. And I was just in there and I felt totally vulnerable because I couldn't even get myself dressed, and they just left me to try to dress myself on a bed with my clothes, and I couldn't even function. I couldn't stay awake. I don't even know why they would let me sit there by myself trying to do that. I have no idea why they would do that to me, or anyone. Why would you have someone that delirious and not try to help them more, or not try to stress them out and just go, it's okay, just relax a little bit more, stay like this, you're good, we'll come back in a little bit, not, oh, you got 15 minutes and we're getting you out of here. And it was like, it was crazy. It was very rude. It was very, very scary, very, very scary, and I didn't like it. And the rest was fine though. Before surgery, my doctor was super cool. She did all the stuff she needed to do, and we talked about everything, and everything went well. Other than that, it really did. So it wasn't a whole huge horrible experience. Just the nurses and the outpatient part. So I will keep you guys posted. I'm gonna try to go now. I think my kids are back, so there goes my quiet. But thank you again for watching, and I just wanted to keep you guys updated. I will get to show you more what they are like when I have a tank top on or whatever, and you'll get to see what they did after I can shower. Probably tomorrow. They said on the fourth day I can shower and take the bandages off. So thank you again for watching, and please like, comment, and subscribe, and ring the bell if you want to know when I do other videos. And always have a peaceful day.